Welcome to 60-Second Nursing. Today, we'll learn about acidosis and alkalosis. We'll quickly understand normal ABG values, how to identify acid-base imbalances, and then test your knowledge with 10 high-yield NCLEX-style MCQs. Let's get started. Acidosis and alkalosis are acid-base imbalances that affect the body's pH. The normal blood pH is between 7.35 and 7.45. This range keeps the body functioning properly. A pH below 7.35 is called acidosis, while a pH above 7.45 is called alkalosis. Acid-base disorders are divided into two types, respiratory and metabolic. Respiratory disorders are caused by changes in carbon dioxide, or PCO, and are controlled by the lungs. If PCO increases, it leads to respiratory acidosis. If PCO decreases, it causes respiratory alkalosis. Metabolic disorders are caused by changes in bicarbonate, or HEO, and are controlled by the kidneys. Low HEO causes metabolic acidosis, while high HEO causes metabolic alkalosis. Remember this simple rule: lungs control PCO, kidneys control HEO. This makes ABG interpretation much easier. Now, let's put everything together. When interpreting an ABG, always follow the same three-step method. First, check the pH to determine if the patient has acidosis or alkalosis. Next, look at the PCOA to identify the respiratory component. Finally, check the HEO to evaluate the metabolic.
Question 1. A 22-year-old male is admitted to the emergency room with diabetic ketoacidosis, or DKA. The patient has rapid, deep respirations. Small respirations are present. The ABG results are pH 7.28, PCO 232, and HCO 314. Which imbalance should the nurse identify? A. Respiratory acidosis. B. Metabolic acidosis. C. Respiratory alkalosis. D. Metabolic alkalosis. Question 2. A 65-year-old female has been vomiting continuously for 3 days. She is weak and experiencing muscle cramps. The ABG results are pH 7.52, PCO 244, and HCO 334. What is this condition? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. Question 3. A 70-year-old patient with COPD arrives at the emergency department. The patient has shortness of breath, cyanotic lips, and is retaining carbon dioxide. The ABG results are pH 7.30, PCO 265, and HCO 326. What is this condition? A. Uncompensated respiratory acidosis. B. Partially compensated respiratory acidosis. C. Metabolic acidosis. D. Mixed disorder. Question 4. A 19-year-old female comes in during an anxiety attack. She says, "I can't catch my breath," and is breathing rapidly. The ABG results are pH 7.50, PCO 228, and HCO 324. What is this condition? A. Metabolic alkalosis. B. Respiratory alkalosis. C. Respiratory acidosis. D. Normal. Question 5. A 50-year-old patient has renal failure. The kidneys cannot excrete acid. The ABG results are pH 7.32, PCO 238, and HCO 317. What is this condition? A. Respiratory acidosis. B. Metabolic acidosis. C. Respiratory alkalosis. D. Metabolic alkalosis. Question 6. A patient has had pneumonia for 1 week. The ABG report shows pH 7.40, PCO 255, and HCO 333. What should the nurse document? A. Uncompensated respiratory acidosis. B. Partially compensated respiratory acidosis. C. Fully compensated respiratory acidosis. D. Mixed disorder. Question 7. A 16-year-old child presents with an aspirin overdose. The child has rapid breathing and vomiting. The ABG results are pH 7.47, PCO 225, and HCO 316. What combination of acid-base imbalance is present? A. Simple respiratory alkalosis. B. Simple metabolic acidosis. C. Mixed respiratory alkalosis and metabolic acidosis. D. Mixed respiratory acidosis and metabolic alkalosis. Question 8. A 45-year-old patient has had severe diarrhea for 5 days and is also having a panic attack. The ABG results are pH 7.35, PCO 230, and HCO 316. What is this condition? A. Simple metabolic acidosis. B. Simple respiratory alkalosis. C. Mixed metabolic acidosis and respiratory alkalosis. D. Normal ABG. Question 9. A patient is on a ventilator and the ventilator settings are too high. The ABG results are pH 7.48, PCO 228, and HCO 320. What is this condition? A. Uncompensated respiratory alkalosis. B. Partially compensated metabolic acidosis. C. Fully compensated metabolic acidosis. D. Mixed disorder. Question 10. A 60-year-old patient with diabetes has the following ABG results: pH 7.22, PCO 260, and HCO 318. What should the nurse think immediately? A. Only metabolic acidosis. B. Only respiratory acidosis. C. Mixed acidosis. Both are abnormal. D. Normal. Here are the answers and rationales for all 10 questions. How many did you get right? Let us know your score in the comments. If you found this quiz helpful, please like this video, subscribe to our channel, and turn on the bell icon so you never miss our next NCLEX practice quiz. Also, comment below and tell us which nursing topic you'd like us to cover next. Thanks for watching and keep practicing. You've got this.